My name is Kevin. I'm from the UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
Speech, you are able to speak words properly and sentences properly.
Just to try to say something.
Treatment is Sunday. After 2 hours I got my voice.
Welcome to our YouTube channel, SLP Sanjay Kumar, Voice Therapist. Hello friends. And we are today before treatment live, and today we are with Chris. Chris is not from India. He's from outside India, and because of the traveling issue and the COVID issue, he has planned to take online voice therapy. And today we are before treatment live, and today date is 8th of November 2021. And the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch his post treatment live. So नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे. आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 8 नवंबर 2021 और हम लोग ट्रीटमेंट से पहले आज लाइव हो रहे हैं. भविष्य में ट्रीटमेंट के बाद भी लाइव होंगे, तो आप लोग हमारा पोस्ट ट्रीटमेंट लाइव जो क्रिस का होगा उसको भी ज़रूर देखिए और इसके लिए आप हमारा यूट्यूब चैनल को ज़रूर सब्सक्राइब कर लीजिए. So Chris, what exactly problem you are facing? Why you contacted us? Please tell us.
Yes, hi Sanjay. So the reason I contacted you is because I was diagnosed with a phonatory gap in my vocal cords. And also like when I communicate with people, when I talk to people, I notice that I can't resonate as well as other people. I can't resonate my voice as well, especially in loud environments. And certain like sounds, it's a bit harder for me to like clearly say. So I notice that a lot of the times when I'm communicating, people have to ask me to repeat what I said more often than for other people. So yeah, after I got the sort of diagnosis from the otolaryngologist regarding the phonatory gap, I decided to find a speech pathologist who could possibly help improve my voice with therapy.
Where you stay and why you decided to take online voice therapy?
So I'm originally born in Lithuania, but I've been living in Barcelona, Spain for the last 2 years, living and working there. And well, the reason I chose to take the voice therapy was, like I said, just I want to improve my communication, which I think will also, improve my confidence in social situations. And well, I found your clinic online, and I saw that you had some good results with patients with even more severe voice abnormalities than me. So that's why I decided to contact you.
Yeah, and because of the COVID pandemic, I am giving mainly online voice therapy at this moment. So, especially for the international patient. So, we can save the time of traveling and we can also protect us from the COVID infection. So, that's why I prefer to give online voice therapy for international patient at this moment. And maybe in the future, I'll be giving online, offline both. So thanks for your faith, and those who have joined newly, the information is that today date is 8 November 2021, and today we are with Chris, and Chris is not in India. He is from outside India, and he is having voice problem. His voice is soft, and in fact he's having phonatory gap also, and for online voice therapy he has contacted to us. And today we are before treatment live, and the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch his post treatment live. तो इन्फॉर्मेशन ये है कि आज हम लोग क्रिस के साथ हैं, और क्रिस इंडिया में नहीं है, इंडिया से बाहर हैं, और इनको वॉइस की समस्या है, इनकी वॉइस लाउडर नहीं है और थक जाते हैं बोलते वक्त, और ईएनटी डॉक्टर ने, ऑटोलैरिंगोलॉजिस्ट ने इन्हें डायग्नोस किया है फोनेटरी गैप। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे। और आज हम लोग थोड़ा बहुत चर्चा करने वाले हैं कि क्रिस को ये प्रॉब्लम क्यों है, व्हाई द क्रिस इज हैविंग द सेम दिस प्रॉब्लम, एंड वील आल्सो टॉक अबाउट द स्पीच प्रोडक्शन मैकेनिज्म, and we will be also talking about the communication disorder for which we provide online services, and we'll also talk about how do you know who are real speech language pathologists and who are the product of the social media without valid degree. So it will help you. So let's discuss first, let's talk about the speech production mechanism. For speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds will generate. Then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. And when we say one sentence, in one sentence there are so many words. In each word there are so many sound. Each sound has own place, own manner of articulation. So it is little complex process. And in this process, there are hundreds of our body muscles works in a very, very coordinated way. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sound generate, we modify that sound into different sound one after another, because in one sentence there are so many words, in each word there are so many sound, and each sound has own place, own manner of articulation. And why this Chris is having the phonatory gap issue? Phonatory gap can be due to so many reasons. Sometimes it can be due to the vocal cord paralysis also, or sometime due to the vocal abuse. And so Chris is not having the vocal cord paralysis, but he's having the phonatory gap. So what is happening? Because when we speak, as I told, the organ which vibrates are known as vocal cords. So when we speak normally, when we put air pressure below the vocal cords, so the vocal cords will come closer together. Suppose if I'm saying or anything, so it will come closer, and there will be very small gap, and from there air will be escaping. But due to some reason, if the vocal cords are not coming sufficiently closer, so some air will escape from this side. Okay, so once the air will escape, so the air pressure which was supposed to be used for the vibration of the vocal cord, but some air will be wasted, and because of that the patient will feel he is getting tired after speaking, and even his loudness will not be sufficient. Because how we increase the loudness? If any string is there, if amplitude of vibration will be more, the loudness will be more. For example, if a guitar string is there and you just do like this, if you slowly will be doing with less energy, you will be doing, then it will not vibrate very much, means the amplitude of vibration will be less and the loudness will be less. But if you do with more energy, then amplitude of vibration will be more and the loudness will be more. So in case of Chris, his ear is getting wasted due to the phonatory gaps. So that's why his loudness is not very much and sufficient. And in fact, some air is getting escaped. And so what we'll do in the voice therapy, we'll try to bring the vocal cord more closer, and that will be there. And other thing will be there. I will try to stimulate the whole mass and the whole length of the vocal cord to vibrate in a more effective manner. So this is the plan of treatment. And because we are going to do it online voice therapy, with the help of online voice therapy, I am at my place and he's at own place, and this is the COVID time, so I am just saying, okay, those who are especially the international patient, just try to take online voice therapy. And so the heading of this live was how to cure voice disorder from home. So the answer is by online voice therapy. And of course, for all the communication disorder, online voice therapy is not very much effective. So we have seen quite impressive result in case of phonatory gap due to the vocal cord paralysis. And we have seen like in case of high pitch voice, feminine voice, and dysphonia. And we have also seen some good result in case of stammering or stuttering. And who is the right candidate for our online voice therapy services and who are not a good candidate, we decide after the perceptual evaluation. So once we do the perceptual evaluation, we suggest some tests sometime, and sometime based on the perceptual evaluation, we decide he's a good candidate for online voice therapy or not. So after the test and perceptual evaluation, we suggest he's a online candidate or offline, or anything can be useful. But for all communication disorder, our online voice therapy services are not available. But if we have certain voice disorder like pitch and loudness issue and stammering and dysphonia due to vocal cord paralysis, voice therapy, our online voice therapy may help you, but right candidacy will decide after the evaluation, perceptual evaluation at least. So those who have joined newly, the information is that again, we are with Chris, and Chris is having some voice problem, and today we are before treatment live. Today date is 8 November 2021, and the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch the post treatment live of Chris. So Chris, there may be some new people has joined, and please tell us where you stay, what exactly problem you are facing, and why you contacted us. Please go ahead.
Sure. So yeah, I'm Chris. I'm originally from Lithuania, but I've been living in Barcelona, Spain for the last 2 years. And yeah, like I said, I've had a phonatory gap diagnosed a couple years ago, which I've had for all of my life basically. And I've always noticed that it's caused me some communication problems because I can't resonate my voice as well as other people, especially in louder environments, and also some specific sounds. They don't seem to come out as clear as I'd like to. And again, I just noticed that when I'm communicating, it's more often for me than for other people. People have to ask me to repeat myself again. So yeah, I found Dr. Sanjay's clinic online after just searching for doctors who treat the phonatory gap, and his results seemed good from his previous patients. So I decided to proceed with the treatment with him.
Okay, thank you, Chris. And I will see that if any questions are there, those who are watching this live, so I'll be discussing those questions. And those who have joined this live, I want to say thank you. And thank you, Basuraj, for joining us. And Prasad K, thank you for joining us and watching us. And Music India, thank you for joining us and watching us. I'm able to read all the comments, so I'll be discussing one by one. And Govind, thank you for joining us and watching us. So let's discuss the questions. Here, Basavraj is saying, hi sir, hi Basavraj. And Prakash K is saying, hi Prakash, hi Prasad. And you can explore our YouTube channel playlist, so you'll get an idea how we work and what are the communication disorder for which we provide our services. So please explore our YouTube channel playlist. And गोविंद कुमार मिश्रा इज सेइंग हेलो सर, मेरा वॉइस बहुत पतली है। मैं 2018 में डॉक्टर्स के पास गया था, वो इंडोस्कोपी हुआ मेरा और रिपोर्ट नॉर्मल है। उसके बाद डॉक्टर ने वॉइस थेरेपिस्ट के पास जाने के लिए बोला। तो गोविंद कुमार, प्लीज कॉल अस एंड we'll do the perceptual evaluation and then we'll comment on your issue, and our contact details are in the description of this video. So once you go to the description of this video, you'll find our website. Click on website and then click on the reach me. You'll find our email ID, contact number, and the Google map where is our clinic situated. So please call us for the perceptual evaluation and we'll do the needful. And very common question I get during the live or sometime on the comment box: sir, where is your clinic situated? So for that, my suggestion is please go to the description of any of our video and you'll find our website. On website, click reach me and then you will find on Google map where is clinic situated, our email ID and our contact number. This is the very common question I get in the comment box. And then some people will ask, sir, how much will be the treatment duration? So treatment duration varies, and it varies according to the communication disorder. So once we do the perceptual evaluation, if needed, we suggest certain tests, for example, stroboscopy or laryngoscopy. We'll see the report and then accordingly we comment on the issues. And other question we get, what will be the treatment cost? So that also varies depending upon what kind of communication disorder you have. Treatment duration varies and accordingly the treatment cost also varies. So again, I'll be saying my contact details are available on the description of any of our videos. In fact, in this live also, you can go to the description of this live and you'll find our website. On website, click the reach me and then you'll find all the details. And so जब मैं लाइव होता हूँ या फिर मेरे YouTube चैनल के कमेंट बॉक्स में जो सबसे कॉमन क्वेश्चन होता है वो ये होता है कि सर, ट्रीटमेंट में कितना टाइम लगेगा, ट्रीटमेंट कॉस्ट कितना होगा। और तो उसके लिए मेरा ये सजेशन है कि आप हमारे किसी भी वीडियो के डिस्क्रिप्शन में जाइए, आपको हमारा वेबसाइट मिलेगा। वेबसाइट पे क्लिक कीजिए, फिर क्लिक कीजिए रीच मी। आपको गूगल मैप पे क्लिनिक हमारा कहाँ सिचुएटेड है उसका डिटेल मिलेगा, हमारा कॉन्टैक्ट नंबर मिलेगा, हमारा ईमेल आईडी मिलेगा। आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनेंगे, समझेंगे, फिर अकॉर्डिंगली हम कमेंट कर पाएंगे कि ट्रीटमेंट ड्यूरेशन क्या होगा और ट्रीटमेंट कॉस्ट क्या होगा। और इनफैक्ट जब क्लिक करेंगे रीच मी वेबसाइट पे तो आप हमारे क्लिनिक का लोकेशन भी समझ पाएंगे कहाँ पे है। तो जो भी ये लोग इस लाइव से जुड़े हैं, मैं सबको फिर से धन्यवाद देना चाहूँगा। और आज हमारे साथ हैं क्रिस इंडिया से बाहर रहते हैं और कोविड की वजह से और इनफैक्ट इन्हें ऑनलाइन ट्रीटमेंट पसंद था तो इन्होंने हमें कांटेक्ट किया और इनफैक्ट हम लोग ऑनलाइन थेरेपी के माध्यम से इन्हें हेल्प करने की कोशिश करेंगे। और जो भी लोग लाइव से जुड़े हैं, मैं सबको फिर से धन्यवाद देना चाहूँगा। अभी हम हैं लाइव में और हमारे साथ क्रिस हैं और धन्यवाद देना चाहूँगा मैं बासवराज को, प्रसाद को और म्यूज़िक इंडिया, आपको भी धन्यवाद देना चाहूँगा जुड़ने के लिए और इस लाइव को देखने के लिए। गोविंद कुमार मिश्रा जी, आपको भी मैं धन्यवाद देना चाहूँगा इस लाइव से जुड़ने के लिए, क्वेश्चन पूछने के लिए। और कपिल जी लिखते हैं, सर आपसे क्लिनिक पर कब मिल सकेंगे? हाँ जी, ये अच्छा क्वेश्चन है। मैं जो है बैंगलोर से बाहर में हूँ अभी, लेकिन इस मंथ के मिडल के बाद मैं बैंगलोर में अवेलेबल होऊंगा। तो इनफैक्ट ऑनलाइन थेरेपी तो चालू है, लेकिन ऑफलाइन जो ट्रीटमेंट है वो 15 नवंबर के बाद से उम्मीद करता हूँ कि स्टार्ट हो जाएगा। तब तक मुझे पहुँचने की उम्मीद है। मैंने बैंगलोर का टिकट लिया नहीं है, लेकिन उम्मीद करता हूँ कि तब तक जो मेरा काम है वो फिनिश हो जाएगा। और तो जो लोग भी इस लाइव से जुड़े हैं, मैं फिर से धन्यवाद देना चाहूँगा। एंड देयर वाज वन क्वेश्चन, व्हेन आई विल बी अवेलेबल फॉर ऑफलाइन ट्रीटमेंट। So after the middle of this month, I'll be available for the offline treatment at my clinic. At present, I'm outside Bangalore. So I'm providing online speech therapy, online voice therapy. So work is going on, clinic is open, our team will be available, and our call center is working. So please contact us if you need our help, especially online at this moment. And if you want offline, then you can call us for the appointment. So thank you everyone for joining us, and those who have joined, the information is we are before treatment live with Chris, and Chris is having a communication problem due to the phonatory gap, and today we are before treatment live. In the future we are going to be post treatment live. And in the beginning of this live, I told there was one question: how do you differentiate real speech therapist and the fake speech therapist, like a product of social media? Because of unemployment, there are some healthcare quacks, they are also writing with their name speech therapist, speech pathologist without the valid degree. So when you are going to take any speech therapy services, voice therapy services, try to find out few information, like the person from whom you're planning to take speech therapy or voice therapy, from where he has studied. Most important question: if the therapist has given the name of the college and university from where he has studied. And the second thing is from which year he has done graduation in the speech language pathology and audiology field, or he has done his post graduation in this field if he is from India. And then you can also just try to explore if he has mentioned any clinic, anything where the clinic is situated in the Google map, if it is available or not. And also if he is from India, try to find out he has given the RCI number, that is Rehabilitation Council of India's number. RCI number will be given to the speech language pathologist after the certification, and after the like once they finish their graduation or post graduation, they enrolled in the Rehabilitation Council of India that provide the license to work. So just try to find out those who will be fake, those who will be chola chap kind of people. They will never mention from which college they have got the degree in the speech language pathology and audiology, in which year they passed either the graduation or the post graduation, and what is the RCI number, Rehabilitation Council of India number, RCI number. So in that way you can just understand, okay, this may be the real or this may be the fake. So I always try to create awareness among the people, because I have seen some time after taking the after doing the wrong vocal exercise, some patient may develop the muscle tension dysphonia, vocal nodule, phonatory gap. So always try to take help from the professional. Even sometimes some other healthcare people, those who are not expert in their own field, they also try to enter in the speech pathology field and suggest some vocal exercise. But instead of following those suggestions, just try to take the help of the expert who are real speech language pathologist and speech therapist. So then only you will get better result. And sometime taking therapy from the healthcare quacks may damage your voice and the vocal cords permanently. So be aware. And so again, those who have joined this live, I want to say thank you. Thank you all for joining us and watching us. And today we are before treatment live with the Chris, and Chris is not in India, he is from outside India. And today we are before treatment live, and the future we are going to be post treatment live. So please subscribe our YouTube channel and don't forget to watch his post treatment live. So Chris, by the time you just tell us what exactly problem you are facing, from which country you are, and why you contacted us, why you decided to take online voice therapy. Just tell us so that people can hear your voice.
Sure. Yes, I'm Chris. I'm originally from Lithuania, but I've been living in Barcelona for the last 2 years. And I was diagnosed with this phonatory gap after going to the doctors a couple years ago. And it's an issue I've had for my entire life. And the issues I'm experiencing is that I find it hard to resonate my voice, especially in like louder environments, and for people to understand me in those environments. And just in general, when I'm talking to people, certain sounds, they come out, they don't come out. I'm not able to sort of say them as clearly as I like. And in general, this just, I've noticed that this causes people to basically have to ask me to repeat myself more often than for other people. So yeah, because of this, I started researching, looking around for speech pathologists that do this type of therapy, and I found Dr. Sanjay's clinic, and the results I saw of that he did with his other patients seemed very good. So that's the reason I decided to also pursue treatment at his clinic.
Okay, thanks, Chris. Thank you so much for contacting us, and we'll try to do the best and we'll help you. And so again, those who have joined newly, information is we are with Chris. Chris is having some voice problem. Today we are before treatment live, and the future will be again live after treatment. And yeah, so if you have any question, feel free to ask us. Those who are at the live, yeah, here is there is one question. Govind Kumar Misra is writing, sir, कभी कभी बोलते बोलते मेरी आवाज लड़का जैसे से जाती है, बस कुछ सेकंड के लिए, लेकिन फिर से लड़की जैसी हो जाती है. तो गोविंद कुमार मिश्रा जी, आप हमें कॉल कीजिए और हमारा कॉन्टेक्ट डिटेल इस वीडियो के डिस्क्रिप्शन में जाएंगे तो मिलेगा. हमारे वेबसाइट को क्लिक कीजिए, वेबसाइट पे क्लिक कीजिए, जब रीच मी तो हमारा ईमेल आईडी, फ़ोन नंबर, गूगल मैप पे क्लिनिक कहाँ सिचुएटेड है, सारे डिटेल्स होंगे. और आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनेंगे, समझेंगे और ज़रूरत पड़ेगा तो कुछ टेस्ट के लिए रिकमेंड करेंगे. और हमेशा हम लोग टेस्ट के लिए रिकमेंड नहीं करते हैं, और फिर हम कमेंट कर पाएंगे कि आपको हम हेल्प कर पाएंगे या नहीं कर पाएंगे, और आपकी प्रॉब्लम जो है वो क्या हो सकती है. तो Govind Kumar Mishra, the suggestion for you is please refer the description of this live, and you'll find our website. On website you can click reach me, and you'll find our contact details, like on the Google map where is the clinic situated, what is the contact number, and what is our email ID. And please call us and we'll listen your voice, and if needed we'll suggest certain tests, and after seeing the report we'll be able to comment on your issue. एंड कपिल लिखते हैं, सर वॉइस थेरेपी बायलैटरल वोकल कॉर्ड पैरालिसिस क्योर हो सकता है क्या? तो कपिल, प्लीज शेयर योर लैरिंगोस्कोपी रिपोर्ट वेयर इट इज मेंशन्ड द बायलैटरल वोकल कॉर्ड पैरालिसिस, एंड इफ यू हैव एनी वीडियोज प्लीज शेयर विथ अस, एंड विल सी द कंडीशन and then accordingly we'll comment on the issues. And our contact details are again in the description of this live, so please call us. And सवाई राम राजपूत लिखते हैं, सर मैं बैंगलोर आकर आवाज़ सही करवाऊंगा. तो सवाई राम राजपूत, सबसे पहले आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनेंगे, समझेंगे और फिर अकॉर्डिंगली सजेस्ट करेंगे आपको बैंगलोर आना चाहिए या नहीं आना चाहिए. तो सबसे पहले हम आपकी प्रॉब्लम को समझना चाहेंगे, क्योंकि बैंगलोर दूर है, तो पहले समझेंगे कि आपको हेल्प कर पाएंगे या नहीं कर पाएंगे. और हमारा कॉन्टैक्ट डिटेल्स इस वीडियो के डिस्क्रिप्शन में जाएंगे तो मिल जाएगा. तो थैंक यू सवाई राम राजपूत. और सवाई राम राजपूत लिखते हैं कुछ प्रॉब्लम के बारे में, लेकिन कई बार क्या होता है कि पेशेंट लिखता है कि सर मुझे एक्स प्रॉब्लम है, वाई प्रॉब्लम है या जेड प्रॉब्लम है, कुछ भी, और जब मैं अपना इवेल्यूशन करता हूँ तो कुछ डिफरेंट प्रॉब्लम निकल के आती है. तो कहने का मतलब ये हुआ कि जब हम खुद का इवेल्यूशन करते हैं तभी कमेंट कर पाते हैं. कई बार पेशेंट खुद से डायग्नोस कर देते हैं, तो मैं उसके डायग्नोसिस के आधार पे मैं डिसीजन नहीं लेता हूं. और आप लोग भी सेल्फ डायग्नोसिस से बचिए, डायग्नोसिस की जिम्मेदारी मुझ पे छोड़ दीजिए, क्योंकि सारे जो प्रॉब्लम हाई पिच पतली आवाज़ वाली प्यूबरफोनिया नहीं होती हैं. बहुत सारे लोग कन्फ्यूज आते हैं, पतली आवाज़ है तो प्यूबरफोनिया है. नहीं, सल्कस वोकलिस के केस में भी पतली आवाज़ हो सकती है, फोनेटरी गैप में भी पतली आवाज़ हो सकती है, मसल टेंशन डिस्फोनिया में भी हो सकती है. तो प्रॉब्लम को समझना ज़रूरी है, और जब हम प्रॉब्लम को समझते हैं फिर हम कमेंट कर पाते हैं कि हम हेल्प कर पाएंगे कि नहीं, आपको मुझे अपने क्लिनिक पे बुलाना चाहिए या नहीं बुलाना चाहिए, कितना हेल्प कर पाएंगे, उसके बाद हम सजेस्ट करते हैं. तो ये था सवाई राम राजपूत आपके लिए सजेशन. और ठीक है, तो आप हमें कॉल कीजिए, फिर सुनेंगे, समझेंगे, फिर गाइड कर पाएंगे. और so those who are joined in this live newly, the information is today we are before treatment live with Krish, and Krish is not from India, and he is having dysphonia due to the phonatory gap, and he is having soft voice, and for that reason he has contacted us, and we are going to give online voice therapy to him. So please subscribe our YouTube channel and don't forget to watch his post-treatment live as well. And what kind of problem, for what kind of problem we provide our services to understand, please refer our playlist of our YouTube channel. So once you'll go to our YouTube channel's playlist, you will find different communication disorders, separate playlists, and you will find pre and post treatment videos. For example, if you'll go to our YouTube channel's playlist, you will find a playlist of like a puberphonia, high pitch voice, pre and post treatment videos. You will find like phonatory gap pre-post treatment playlist, and you will find stammering playlist, you will find sulcus vocalist playlist, you will find aphasia that happens after the stroke playlist, you will find functional aphonia playlist, you will find spasmodic dysphonia playlist, you will find functional dysphonia playlist, you will find misarticulation playlist. You will also find after doing the hearing evaluation, once we fitted the hearing aids machine, how the communication of the patient improved, who was the right candidate for the hearing aid. So to understand our work or to understand how a certified speech language pathologist and audiologist changes the life of people, please explore our YouTube channel playlist also. So that will give you an idea. And so thank you all for joining us and watching us. Thank you so much. And if you are having any question, I'll be able to give the answer because I am able to read your questions. So feel free to contact us if you have any communication problem. And yeah, so I'm able to read the. So thank you all for joining us and watching us. Just 1 minute. एंड जो लोग भी इस लाइव में जुड़े हैं, मैं बता देना चाहूँगा आप सभी को कि आज हम क्रिस के साथ हैं और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और आज डेट है 8 नवंबर 2021 और भविष्य में हम लोग ट्रीटमेंट के बाद लाइव होंगे। हम क्रिस को फोनेटरी गैप की वजह से वॉइस की समस्या है और हम लोग भविष्य में ट्रीटमेंट के बाद भी लाइव होंगे, तो आप लोग हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए और क्रिस का पोस्ट ट्रीटमेंट लाइव भी जरूर देखिए। और हम अभी आप सभी के क्वेश्चंस को पढ़ पा रहे हैं, तो अगर आपको कुछ पूछना है तो आप लोग पूछ सकते हैं और हम आपके क्वेश्चन को पढ़ पा रहे हैं। जो लोग इस लाइव में जुड़े हैं, मैं सभी को फिर से धन्यवाद देना चाहूँगा। मैं धन्यवाद देना चाहूँगा बासवराज को, प्रसाद को, और मैं धन्यवाद देना चाहूँगा म्यूज़िक इंडिया को, मैं धन्यवाद देना चाहूँगा गोविंद कुमार मिश्रा को, मैं धन्यवाद देना चाहूँगा कपिल जी को, और मैं धन्यवाद देना चाहूँगा स्वामी राम राजपूत। Thank you everyone for joining us and watching us. And if you have any question, and if for those I have not given the answer for that question, I have not given answer, please write in the comment box. In the next live, I'll be trying to give the answer. So thank you all for joining us and watching us. And thank you, Chris, for live. I think my next patient, those who have the appointment, they are calling. So I need to stop this live. So thank you all. Love you all. Thank you, Chris, for helping me in the mission of creating awareness about the communication disorder. Thank you so much, Chris.
Yeah,
and
glad to help.
Yeah, thank you all for watching, and thank you so much. We'll stop this live. My patients are calling, those who have the appointment. Thank you all. Thank you so much.